Okay, good day, friends. This is Salochan here at the lab. Just wanted to share something of what I believe is of great importance to all patients, all persons. These here, you would recognize them. These are urinary dipsticks. This first one here is a normal one. You know, all these colors here. This is what happens. There are color changes that happens when the strip is introduced into the urine. Of course, you want to use in diagnostic realm, you want to use the best strip, you want to do the procedure properly, and you want to examine it at a certain time. And these are the things that our students are also given information on not only how to do a test, but how to do it properly and even examine it properly. So you see this one here, this is a normal strip. Every single dot here is an abnormal thing. I have some important things to share with you. Please bear with me, but I think it could help you, it could help benefit someone you know. This is a normal strip here, except for, well, just get a little bit ketones. These are ketone bodies that are found in some patients' urines. It can be caused by different things, but one of the most important thing is when the body is not getting glucose as a source of energy. It utilizes other forms of energy from muscular tissue, from organs, and then now a byproduct of utilizing other sources of energy is ketones. You get it in pregnant women, you get it in people who are malnourished, who are doing extreme fasts, due to religious or personal reasons. This, as I mentioned, is a normal strip. As you can see, all the colors are pretty much bland. Forgetting these two here, these two are specific gravity and pH. They are highly variable, but is not the key area of my discussion this morning. Now, here, you have this one here, leukocytes, and you have protein. So this patient has a lot of white blood cells and a lot of protein in their urine. All right, well, significant protein. This one also has a lot of leukocytes, has what is called nitrites. Nitrites is a chemical that is formed when there's great amount of bacteria in the urine. Some bacteria convert nitrates in the urine, and in utilizing nitrates, they produce nitrites. This patient also has a lot of protein in their urine, and my goodness, also a lot of blood. This picture here, this urine, we can make some inferences, but the rest is in the hands of the doctor. But we can make some inferences. This patient possibly has a serious urinary tract infection with some issues that is causing blood, what is called hematuria. The hematuria may be causing the protein, or the protein might be a culprit on its own. We wouldn't know unless the blood is gone, after the patient blood or presence of blood is gone. So much can be found from urine testing. Now also another interesting case, but we've got a lot of leukocytes. This patient has protein, has glucose, significant glucose, and blood. This patient also, everything else in the dipstick is normal, but the patient has a lot of glucose, 4+ glucose. I want to show you something here. Apart from all these different interesting findings, I want to show you something here, how the body is so connected with its different systems. So this patient here has leukocytes, has possibly a urinary tract infection, there's protein, but yeah, the patient is also passing blood. This patient also has leukocytes, is possibly a diabetic because of the amount of glucose in the urine, and possibly also there's protein. Maybe, I'm using the words very sparingly, maybe kidney involvement. But as a result also, there can be now blood being passed in the urine. Blood is being passed in the urine. This patient here has a lot of glucose, but there's no blood. I just wanted to show you this. Again, just to recap, a normal urine dipstick. This one has some ketones. This one has some leukocytes and some protein. This has a lot of white cells, nitrites, that is highly suggestive of bacteria levels, protein, and blood. Not a good situation in this urine dipstick. This one also has leukocytes. This one has also protein and glucose, and it seems as though because of the whole aspect being under stress, now there's blood also being produced and passed in the urine here as well. You see, many times we find a lot of people having infection, having inflammatory issues in their urinary system, they pass blood. This is as much as we can say right now. We could make other informed or maybe other inferences, but for now I just wanted to show the public how interesting urine tests are. And you can check us out at Medical Scientific. You can check us out at our laboratory. You can contact us at our school, Medical Scientific Educational Institute, to not only learn about these things, but to also see how important it is and even understand more of your own results in the future. Take care.